Dental treatments for sleep apnea. Do you regularly feel tired and have trouble concentrating, even though you get 7 to 8 hours of sleep most nights? Does your partner regularly complain about your snoring? If so, you may be suffering from sleep apnea, a common sleeping disorder that can have long-term negative health effects. Hi, I'm Jim with the Adriatic Dental team in San Marcos, California. In this short video, I'm going to give you a brief introduction to sleep apnea and then explain some treatments that I or your local dentist can provide to manage or even eliminate the symptoms of sleep apnea. Sleep apnea can affect anyone, including both men and women, children and adults. In many cases, an individual doesn't even know that they have sleep apnea because it happens during sleep. In a nutshell, sleep apnea occurs when a person stops breathing for short periods during sleep. The most common form of sleep apnea is obstructive sleep apnea, OSA, where the airway is blocked during sleep by soft tissue in the back of the throat. Those with sleep apnea can have their sleep interrupted over 100 times during the night and not even be aware of it. The body doesn't respond well to all those interruptions. After all, sleep is the body's primary recovery mechanism. The symptoms of sleep apnea include fatigue, difficulty concentrating, extreme sleepiness during the day, increased blood pressure, increased risk of stroke, increased risk of heart attack and heart failure, increased risk of diabetes, increased risk of depression, and worsening of ADHD. Once sleep apnea is suspected, there are a variety of treatments available. The type of treatment recommended will depend on the individual situation of each patient. The most basic treatment is behavior therapy. Sometimes just avoiding alcohol, sleeping pills, and other sedatives before going to sleep is all that's needed to correct the issue. In other circumstances, patients have seen improvement by switching from sleeping on their back to sleeping on their side. For more moderate or severe cases of sleep apnea, there are other treatment options, including medications that encourage breathing during the night, or even a continuous positive airway pressure device, CPAP, which is a mask that patients wear during the night that forces their airways open with pressurized air. Many patients find the CPAP device to be very uncomfortable and seek other treatment alternatives. Luckily, the solution to sleep apnea may rest with your local dentist. In cases of sleep apnea, I usually prescribe an oral appliance therapy, OAT, which is a custom-made mouthpiece, kind of like a retainer, that moves the lower jaw forward so that the airway remains open throughout the night. Another option at your dentist's disposal is a DNA appliance, which is similar to an OAT, but actually encourages changes in your jaw and teeth structure to permanently eliminate sleep apnea. Learn more about DNA appliances from my short informational video on the topic. Most dental interventions for sleep apnea are ideal for mild to moderate cases of the disorder. If sleep apnea is severe, your dentist may refer you to an oral surgeon for surgery. If you or someone in your family is suffering from the symptoms of sleep apnea, schedule an appointment with your dentist right away. You can call me with questions at 760-591-3434 or visit our website at www.healthygumsandteethnow.com or stop by Adriatic Dental. We're located in San Marcos and also serve the cities of Oceanside, Escondido, and Vista. At Adriatic Dental, we can't wait to see you smile.